Genetic counseling, what it means for your colon cancer risk. Imagine uncovering the hidden story your family history might tell about your health. Genetic counseling is a process that helps you understand how your inherited genes could influence your risk for colon cancer. It involves a detailed look at your family's health history, personal medical background, and sometimes genetic testing. This process educates you about hereditary cancer syndromes, the pros and cons of genetic testing, and what the results could mean for you and your loved ones. About 1 in 10 cases of colon and rectal cancers are linked to inherited gene mutations passed down through families. If you or close relatives have had colon cancer at a young age, say under 50, or if there are multiple cases in your family, genetic counseling becomes especially important. Certain conditions like Lynch syndrome are known to increase colon cancer risk significantly. Lynch syndrome is the most common inherited condition associated with colon cancer and also raises the risk for other cancers such as endometrial, stomach, ovarian, and pancreatic cancers. People with Lynch syndrome often develop cancer earlier than the general population, and their relatives have a 50% chance of inheriting the mutation. During counseling sessions, a specialist will gather detailed family health information and may suggest genetic testing if it's appropriate. These tests look for mutations in genes linked to colon cancer risk, such as those associated with Lynch syndrome or familial adenomatous polyposis. The counselor will explain what the results mean, including how they could influence your screening schedule, prevention strategies, or treatment options if cancer develops. Genetic counseling also helps you understand your personal risk based on your family history, whether your family's pattern suggests a hereditary syndrome, and the accuracy and limitations of genetic testing. Knowing your genetic risk can lead to earlier or more frequent colonoscopies, which are key to catching cancer early. It can also guide decisions about preventive measures or inform family members who might benefit from testing themselves. Even if genetic testing doesn't find any mutations, counseling provides valuable insights based on your family history, helping you plan appropriate screening and risk management. If a hereditary mutation is identified, you might consider options like more frequent colonoscopies starting at a younger age, or in some cases, preventive surgeries. The goal is to empower you with knowledge so you can make informed choices about your health and your family's well-being. Overall, genetic counseling is a vital tool for understanding inherited colon cancer risk. It supports personalized prevention and early detection strategies, which can make a real difference in health outcomes. If your family has a history of colon or related cancers, or if you experienced colon cancer at a young age, talking to a genetic counselor can help clarify your risk and guide your next steps. Remember, each person's situation is unique, so it's always best to consult healthcare professionals for tailored advice and care.